Congratulations. We do have a lot of themes, and Bob and I are thinking perhaps, if you used in vivo, we might compare our code books, because the qualitative research that the data that we have in the STAR project, we're just delving into with a lot of seriousness. But one thing I want to bring out is the socialization that you hit on in terms of new nurse graduates, and how important it is, some of the interviewing that we picked up, that the seasoned nurse often throws the new graduate into a situation so they can learn how to work around. And the rest of the story then is that in some of our post-interviews, the awareness is raised about workarounds, provide the Swiss cheese whole lineup, and then patient safety issues. So that's a very interesting thing. And the other point is, I think, what we learned with Amanda there in the units is that branding the project makes it real. There's so much attention that's demanded in the unit. And I love your branding of the Open 24/7, and the STAR was something that they became, they referred to Amanda, oh, there's the STAR person. So when she showed up to intervene or collect data, and I think it's the reality of the work setting. It's not an academic setting. It's a real, on your feet kind of setting. Congratulations.
Nancy. I also wanted to congratulate both teams for all of your work, but also your efforts in dissemination. And so maybe you could comment a little bit on the efforts to reach the consumer that you were.
Well, we've only just, by consumer, I think in this case we mean the nurse at the bedside and also the nurse managers. And we've, in the presentations that flew by really quickly, we've presented at AONE meetings. We've had stakeholder meetings both in Dallas and in Houston with people in the community getting continuing education units. That was one way, one gimme that we could provide, was continuing education for learning about the results of the study. The website's been very helpful. I just checked the analytics, and we got about 200 hits this last month. And people are spending 6-point-something minutes per visit to the website. So I think I would urge people to have a website where you could disseminate things quickly. We did not have a great deal of success with our Stakeholders Council in terms of getting them involved, other than at the very beginning when it was new. They were very helpful in supporting us and giving us ideas. But then we sort of lost them, and it was difficult for us. We had webinars scheduled, and that wasn't working. So I would say the website, if I could only do one thing, it would be to have the website.
One more question.
I actually just went to your website, the thing about being connected. I wanted to be sure I got it right, so I thought, okay, well, try what you heard. And it is a beautiful website, and I was particularly interested in your bibliography. I think it's a great gift to nurse leaders to have an annotated bibliography. But I wondered, it seems to me one product could be a systematic review of that literature and a synthesis, either meta-analysis or meta-synthesis. Is that a product that you believe is timely and appropriate, or does it exist and we just don't know?
I don't think it exists, and there's lots of reasons. That,
a doctoral student has submitted it for review last week.
Oh, really?
I don't know if it's exactly the same literature,
yeah,
but
well, that's wonderful news. I will say what I heard from ARC when at one point in our history we went straight to them and were asking them to support that kind of work, and they, meaning the one program officer I spoke with, said, look, we know there's a problem. We don't want to waste any more time documenting the problem. Tell us how to fix it. Well, I wish I could. There's just, I think the empowerment of the nurse at the bedside to be a participant and to solve those kinds of problems, just like what you all are doing. But also the empowerment of the nurse manager. That is a terrific burden that nurse manager has to shoulder every time that productivity chart is shown at an administrative meeting. And you are made to account for the fact that you've brought in another nurse because you had higher acuity. That takes courage, and it takes some savvy to learn how to do that. And so the leadership innovation that's been funded, I think, is wonderful because leadership is key.
Hi, Martha Curley. I have to comment on both these presentations from a stance, and both pieces of work I think are critically important, but both of the presentations talk about nursing empowerment. And I'm sorry, I don't know, I've never practiced in an environment where staff nurses have been disempowered. And nurses, in my experience, are always voiced. They control the care environment. When they you know, these rooms full of like the commodes and everything, I mean, nurses own it and they fix it. And so I don't know where the disconnect here is with our language around it, you know, disempower and re-empower and empowering nurses, where I don't think that is, at least in my experience. And maybe we could talk a little bit about, you know, have either of these groups looked at what Linda talked about earlier with levels of education, basic preparation, shared governance models, or what is it that both of these presentations have focused on the disempowered nurse?
We were going to talk about, it was south of the Mason-Dixon line. But I think one of the things that we see south of the Mason-Dixon line, and maybe it's unique to Texas hospitals, is the tremendous multicultural representation within our workforce that really does affect the level of feeling of nurse empowerment. As well as, I think, some of the educational preparation. We have a higher percentage probably of ADN prepared nurses in our workforce than in other places in the country. So, you know, East Coast, West Coast, they tend to be ahead of the middle of the country.
Well, and I'm seeing some of this still in New York, though, and we do have a melting pot of cultures as well, and also education.